Hello and welcome to IIPA's special series, which is Stalwarts Speaks, and in which I've been interviewing some special personalities. I'm Rakhee Bakshee. Today also we have a very special guest with us and somebody who is going to talk about administration in health infrastructure. And I'm going to talk to Dr. Randeep Guleria. He's the director of AIIMS, Delhi. Welcome to the show, sir. Dr. Guleria, it's such a pleasure to have you here. And, talking about health, as I introduced, we have to look at the entire landscape, and somebody who's been really there handling things, especially at COVID-19 platform that we saw you. How would you really see it currently right now? What should be the health infrastructure platform that we should have in the country today?
So if you look at the health infrastructure, I think a lot has changed because of the pandemic. And because of the pandemic, health has become part of the center stage as far as administration is concerned. Because I think we've realized that you need to be healthy for all other parts of the economy, travel, trade to be operational. And that is something that came out very, very solidly in the pandemic, which probably was not that much of a concern in the pre-pandemic era. But it also brought together the fact that we need to now look at health with the future doctors. How do we build infrastructure where we can provide care both at a primary level, secondary and tertiary level? How do we look at a public-private partnership so that there is healthcare is provided using a wider landscape? And at the same time, how do we make ourselves Atmanirbhar in terms of providing equipment, in terms of providing care? And as was said by our Honorable Minister, that we should have a policy of being able to heal in India and heal for India.
This crisis, so to say, also taught us a lot. What are the learnings according to you, Dr. Guleria?
So this crisis taught us that we need to really develop strategies which are sustainable, and we need to be having a few things which I think are very important. One is a good surveillance system so that we pick up any outbreak or anything that happens early rather than late and are able to contain it. It also showed that we need to focus a lot on our primary health systems so that we are able to provide care there rather than patients having to travel long distance. And that includes critical care and other severe disease management, and develop a technology-based management system, which we learned during the pandemic in the form of telemedicine, teleconsultation, eICUs, which was very useful during the pandemic. And how can we take this forward so that patients even in remote area can be managed and looked after if they need support by doctors who are situated in a tertiary care center far away.
So basically, we're also talking about digital health system. In fact, our Honorable Prime Minister has talked about it also and the need for it. But why do you think it can't be really done in a big way? I mean, there seems to be some hesitancy when ERs, are concerned. I mean, so for example, the data overall on this, what would be your take on that?
So I think digital health is going to be very, very important, and it has to be done. The challenge, of course, is that we have a scattered system as far as digital health is concerned, because we have a strong private sector, we have a government sector. The digital health is lying in silos. Patient moves from one area to the other. The health record has also to move in a similar fashion, in a seamless fashion. You have a patient who may show in a government hospital, and then he may go to a private hospital. Now, the data should be, one should be able to take the data across, and the data protection is important. The patient may not want that his data is shared by another doctor because he wants that confidentiality maintained. So all that needs to be developed.
How do you think there can be a formula to take up a middle path, so to say?
So first is to get all stakeholders on board and make them understand that confidentiality will be maintained and this data belongs to the patient. The patient should have the right to decide whether he wants this data to be shared with the doctor. So like you have a message which comes to you, you can tick mark on your phone that you want this data to be shared, and then the doctor can download that data and see whatever data that you are willing to share with the doctor. And then that can be part of a transparent mechanism. Also, private sector and the government sector have to come to a common digital platform where data can be shared. So that, I think, is the challenge that we have to get all, let's say, private sector organizations, because all of them have their own database. And sometimes people are not that willing to share the database for various reasons, and we need to really overcome that hurdle.
So you refer to public-private partnership also, the PPP model, which is very much in vogue, being talked about. How would you say that in the health department or health sector, all this can be done effectively? For example, you have a lot of multi-specialty hospitals coming up in urban areas when you see, but in rural areas, look at the PHC and the status there. How do we really see a coming together, a kind of convergence also, so to say, where we really look at it collectively and a unison of our vision towards the health sector?
So when you look at the public and the private sector, we need to look at two things. What is the responsibility of different sectors? And I think the public sector has a lot of responsibility in preventive health, and they can focus a lot on that, which can also be supported by the private sector in terms of screening and being able to manage patients if they have a disease. For example, you could screen for hypertension, you could screen for diabetes, and for various non-communicable diseases. And this program is going on in some states. Like you said, in the primary health center, the investment that private sector is willing to make is not that much because the returns may not be there. So we have to develop an ecosystem where there is support to the private sector, and in terms of the fact that they feel that this is a good investment. So if you are able to develop an infrastructure where treatment is either covered by insurance, like if you have Ayushman Bharat, and this is given to the private sector, they may be able to then develop a model there where they're able to get the returns, and it's not a loss, it's a profit, and therefore it helps the sector, it helps the area, because once you have let's say a hospital in a rural area, it builds a lot as far as the economic development of that area is concerned. And at the same time, the cost is then sort of shared as part of the insurance scheme, and therefore it turns out to be a profitable investment.
So which means you're saying that affordable healthcare is not really that far if we really work at it strategically.
Exactly. Affordable healthcare is possible. We have to develop a strategy where we are able to make sure that affordable health is done in a way that it's profitable to the private sector, but we are not looking at a profit which is extreme, but something which is also looked at like a social service with some degree of profit.
One of the things we saw, sir, during Corona time is that how medical professionals really came to the fore in terms of putting in the service 24/7, not only medical professionals that we saw visibly in terms of being doctors, but the paramedics, the other medical staff. In fact, they were hailed by the leadership also as Corona warriors, and everybody actually thanked them. Where do you see this collective force really rising up and a crisis like the pandemic that we have just seen? How would you really look at this whole collective energy coming together?
So I think this showed the resilience of our country, and it shows the strength that we have, and how whenever there's a crisis, we can come together to manage that crisis irrespective of the fear that we may have. I remember the early days of the pandemic when there was the fear of the unknown. People were scared that if they got the infection, they could take it home and their elderly parents or children would get it, and they may have a severe illness and they may die because of that. Healthcare workers, despite that risk, came forward and said that we are willing to really take care of these patients, willing to really be involved in the care of these patients, from screening to management. So I think healthcare workers at all levels, doctors, paramedics, even I would say at the rural level, the ground level, ASHA workers, all of them came forward during that time when there was a lot of fear. And a lot of our residents told me that, I don't know what will happen to me, but I'm still willing to come and work in the ICU. And
what about the challenges, sir? We did face challenges.
We did face challenges. I in the hospital had many challenges. The nurses were reluctant. Some of them were not wanting to go home. They stayed here for many days rather than going home. Doctors were having problems. There was a stigma regarding the doctors, and in many places they were asked to vacate houses by the landlord and things like that. In the early days, that was there. But they overcame all of that because they felt that there was a commitment that they had towards patient care. And that was something which really came out strongly. And I think once that came out, then it became the whole of country involvement, because then people realized that if healthcare workers are really involved like that, they also got involved. And I can say that in the later months, every citizen of our country became a COVID warrior. They came forward, whether it be distribution of food, getting clothes, or doing other activities during the lockdown, during the later phases. I would say that even manufacturing, we had a time when we thought we'll have shortage of PPEs, shortage of N95
Exactly.
masks. The industry came forward and started making these N95 masks, PPEs, and now we're exporting them.
So hospital administration, sir, was also being looked at that time. More and more, I thought.
Hospital administration had a challenge because you see, when you are having a pandemic of this nature, you have to reappropriate your resources and you have your limited resources. I can't overnight say that we will get 1,000 nurses more or 1,000 doctors more. So we have to see how do we train them. And so we developed modules of training people overnight in terms of infection control, in terms of managing COVID, people who had never managed respiratory diseases, people who were in clinical subjects, pathologists, physiologists, or people who were doing orthopedicians for that matter, or gynecologists. They are not trained to manage critics. So we quickly trained them and used them as part of our force so that they could manage patients and we could take in a large intake of patients during the surge that we saw in the various waves. So that was something that administration had to do. Then to keep them motivated. And that was another big challenge because every time there is this infodemic, the fear that this will happen, this is going to happen.
Yeah.
So you have to counter that. So there were a lot of challenges from the administration point of view, even for your resources. How do you then reappropriate your resources? You need more ventilators, you need oxygen, you need other things. So that also had to be worked out. And I think that was a challenge that the administration had along with patient care.
Okay, but as part of COVID-19 response team, and we really saw you there sharing inputs in a very larger way. What was the experience like, Dr. Guleria, at that time?
So I think it was a big challenge, but I think what really made a big difference was that there was total alignment from the top to the bottom. So from policymakers, from our Honorable Prime Minister to the Minister, to all the policymakers, to administration, to doctors and scientists, to the workers, there was an alignment and everything was done based on the science and whatever data we had at that given point in time. That helped everyone to really feel confident that we are doing things in the right way. We are not getting sort of swayed by emotions. And I think that really was the success that India had because everything was aligned and there was freedom to be able to do things. The Prime Minister's office set up a lot of empowered groups, which was multi-sectorial, because that was also very important. Like I said, in managing the pandemic, you needed multiple areas of support. It could be from the point of view of, let's say, transport, because during a lockdown, you need to have everything coming in. It could be from delivery of vaccines. It could be from the point of view of oxygen or drug supply. So all of that, because it was multi-sectorial teams in the powered group, one was able to see all of this happening in a seamless manner.
Okay. And then came the whole idea of vaccines and vaccination. How would you really look at that journey? Today, we can really be proud in saying that the vaccination has happened in terms of addressing a large volume of population in our country. Where would you look at the strength?
So I think the vaccination story has been a huge story of success as far as India is concerned. Before the pandemic, India was producing a large number of vaccines. We were still the large vaccine producer of the world, but we were not into research and development. We were not making new vaccines. We didn't have a platform that we could say that we will be able to manufacture a new vaccine. And we faced this problem during the swine flu pandemic, in H1N1 pandemic, that we did not have our own vaccine. And by the time we could make the vaccine, it was too late. This time, I think we realized that we should have, and I think the government really put in a lot of effort, that there should be our own manufacturing of the vaccine. We should do research and development in vaccination along with production. So the R&D part started very early, and I would say that this is something which the government pushed a lot. And this helped in developing, doing research and transfer of technology to industry so that they could quickly start manufacturing our own vaccine. Imagine if we were not able to do that and we had to rely on, let's say, WHO to give us vaccines, we would have a huge problem in terms of the doses that would be available and when we would get them. So because of the fact that this was really thought of very early, investments were made, planning was done, vaccination...
right from urban areas to far-flung areas.
So the vaccine got developed. Simultaneously, a lot of work was done to see how we can have delivery right to the grassroots level. And that is another success story. How do we built more storage areas for the cold storage? How do we make sure that there are enough syringes and needles to give this injection? Because you need that many syringes and needles over and above what you're already making for routine care. How do we make sure that all sites are trained to give the vaccination? How do we monitor for any side effects? Because this is a new vaccine. Everyone is worried about the adverse effect which may happen. And at the same time, be able to provide it in a seamless manner so that across the country, the vaccines reach on time and you know where there is a big need and how you can deliver them. And that is also something that is a huge success story, including the platform that we have, the CoWIN platform, which has done remarkably well, that you get your report, you are able to see your data. And of course, we have been able to deliver vaccines. And I think now we can be proud that it is the largest vaccine program of the world, which has worked so successfully. And considering the challenges that we had, I think India has done remarkably well.
Also, because we have had the past, in the past also we saw that for example, in the Dhanush scheme, I mean the polio vaccination. So vaccination stories as such not new entirely to us.
Yes.
What would you say about that?
That's true. But if you look at the previous programs in the Dhanush program or the polio vaccine, we were looking at vaccine only for pediatric age group or for pregnant women. Now we're looking at adult vaccination. So the scale of things is huge. For pediatric population, we were looking at, I think, 6 to 7 crore vaccines a year. Now we're looking at 100 crore, 200 crore vaccines, so 2 billion vaccine shots, because you have to give 2 shots, you have to look at booster doses, things like that. So the scale has gone up tremendously and we were able to reach that scale. That is, I think, the biggest achievement. And at the same time, make new vaccines. And now India is in a position where we're making many other vaccines on different platforms. An mRNA vaccine, we made the world's first DNA vaccine, and we have now so many other vaccine platforms. So a number of vaccines are being produced in our country, which is remarkable. One could never have thought that this was possible 2-3 years ago.
Everybody would love to ask this, or they're eager to ask whether the pandemic is over.
So that's a tough question, because it's difficult to predict how the virus is going to behave. I would say that we are in a much better position than what we were a year ago or 2 years ago, because then as a part of, let's say, mankind, we were not having any protection. We were naive to the virus. Now, because of natural infection and because of vaccination, we have a good immune response in our body. So our ability to fight the virus has become much better than what it was 2 years ago or 1 year ago. And therefore, even if we have new variants coming in, we will be able to have a good immune response. And therefore, I feel that although we may have ups and downs in terms of cases, hospitalization and deaths will not be that significant. And possibly we will not have a strain on the hospital infrastructure like we saw last year.
But now that we are seeing things opening up and there is a little bit of ease, I would say, compared to the earlier times, what would you say about the road ahead, the coming days?
So I think we have to be careful, and I would still say that we need to be cautious. Surveillance is very important, picking up any cluster or new variant which comes. People still have to be a little careful. Gradually, I know it's difficult because it's been 2 years and it's been a tough time. But as things open up, it's important that we keep a close eye on how the virus is behaving and have a plan in place so that in case things sort of move towards an increased number of cases, we are able to clamp it down.
So coming from IIPA, this question I need to ask is that when you talk about public administration and public policy, there are two things. So let's look at the administration day-to-day part, and let's look at the larger policy framework. What would you say about health as such, that how it is being done?
So I think as far as health is concerned, it is a state subject, and also a lot of policy is driven by the centers. So there is now a lot of coordination between state and centers. But that has to be looked at in a holistic manner, because there are some states which have a very good administrative and health infrastructure, and there are others which are still facing a big challenge. So we need to really learn from states which have done well, see what policies have helped there, and see how we can move that to states which are needing some degree of support. And I think that can also be supported administratively, financially, so that we are able to provide comprehensive health across the country of the same level.
Okay, talking about the Disaster Management Act, the idea emerged that health is something that you're seeking, but it has become almost mandatory. We must have it because we want it. So that is what became clearer. What would you like to say about that?
So I think that is one of the learnings from the pandemic, that the health is something that should be there. It's not something that one should seek. It should be already there, and this is something that is there in the Western world. So universal health and universal health coverage is something that we should have. And I feel also there should be more investment in preventive health. We have a lot of investment in tertiary healthcare systems, but we should try and see how can we prevent people from reaching the tertiary level, so that we are able to provide preventive health and also early diagnosis, and therefore be able to manage patients in a more cost-effective manner.
How would you look at the human behavior now? How do you think citizens have become, do you think they have become more alert, or have they become conscious of the fact, because one has seen the crisis of pandemic, that there are new things to really learn? One has to also look at oneself, and then mental health also is being talked about. So the holistic approach, as you said.
So citizens have become more conscious of their health. We saw that during the pandemic, and there are now people who are aware of looking after their health. Only challenge that I see is that I hope it's sustainable and it lasts, because people tend to forget a lot and go back to old habits. So that is one thing that I hope.
What would you say about old habits? Because people used to connect much more. Now this social distancing and masking also meant to restrain. And the whole idea of restraint is, I think, in our country is something that we are learning actually.
So we're learning that. We're learning the importance of looking after your health, getting your regular health checkup done, sort of you looking after your diet, exercise, yoga, things like that, which were not looked at that aggressively before the pandemic. But this has to continue, because as you go back to your day-to-day life with more and more stress and strains, then like you said, your health becomes less important, and mental health and work pressures become more important. Also, I think the pandemic brought to fore the issues that we have not discussed, and that is mental health. That there is an issue of mental health which needs to be discussed. There is in our country a lot of stigma attached to that. If you tell someone to see a psychiatrist, they get upset that you think that I am become a mental case or something
unstable,
like that.
Yeah.
So that realization has come both among people and among doctors, that a lot of issues which are related to mental health have been brushed under the carpet, and we need to start addressing them and start looking at it in a more holistic manner, in terms of how do we reach out to people who have mental health issues, rather than waiting for them to come to a doctor and then take treatment.
And about gender, like women need to also look at their health and take it more seriously, isn't it?
That's very, very important, because women form the backbone of a family. They have so many other responsibilities when it's looking at maternal health, looking after the newborn or the child, and also supporting the family. So health of women is, I think, very, very important. Again, this is some area where we need to move forward, because there is a gender bias in many areas, and that needs to be corrected, even when it comes to the health sector.
So you have been credited with starting a center here, as far as pulmonology is something that you're an expert on, sleep disorder also. How do you really like to take it up? Something that is born out of your passion also.
So again, we are seeing a surge in pulmonary diseases, both infections and non-infective causes. And many of them are preventable. And therefore, I would like to really work aggressively in trying to prevent them. Factors which contribute to respiratory diseases are things like air pollution. How can we work in decreasing the air pollution and improving the quality of air in many cities in our country? How can we look at the use of tobacco, smoking cessation? Many respiratory diseases are known to occur because of smoking that people do, and cancers are known to occur because of that. So like I said, preventive health, how can we work on that? Another respiratory problem which is there is tuberculosis. We are working on eliminating tuberculosis, and that is another challenge that we have. How can we work on eliminating tuberculosis by 2025? And there has been a little bit of, let's say, a decrease in that drive because of the pandemic, which we need to now do a catching up in terms of coming back. And that also is something that, if I may add, is a learning from the pandemic, that if you have to develop strategies, you must also develop strategies for the other diseases which are collateral damage. A lot of focus went on COVID, but affected immunization program, it affected the TB program, it affected others. So a strategy where you are focused on managing a pandemic, at the same time you don't miss out on other diseases, because they also will lead to higher mortality, is something else that we need to work on.
So one slogan which one heard about, and I would just like to put it here, is that Sarkar, Bazar or Samaj. So how the leadership looks at things, how the market looks at things, and how the society behaves. How would you really look at that?
So I think it has to be a whole of government and a whole of country approach, whole of citizen approach, and everything has to merge. Health is an area where you have to look at it also as a social commitment and a social service. So it cannot only be looking at from a profit point of view. And that is something which the policymakers and the citizens have to realize, that health is a social commitment also. There has to be a degree of profit, because the private sector cannot survive unless there is a profit. But at the same time, it has to be done looking at health as something which is social service in the back, as a primary thing.
Sure. Your latest book, How to Win, and would you like to write further? Are you looking at more writing?
I am looking at more writing, and once I get time, and I'm hoping that now with things settling down, I should have some time and be able to write about the learnings that I've had, because I think there have been a lot of learnings, and I'm hopeful that that can be used by people subsequently as we move ahead.
Any such message to a lot of people who are watching you right now in terms of the holistic aspect of convergence of looking at our journey towards health, and everybody coming together to take a resolve, so to say, that be healthy and be happy?
So I think those two things are very important, to be healthy and be happy. To be healthy, it means that you must not wait for an illness to come to you. You must develop mechanisms so that you give time to your health, whether it be exercise, whether it be your diet, and be focused on not having a disease but staying healthy, both as far as your mind is concerned and as far as your body is concerned. And if you are healthy both in your mind and body, then you must be happy, you must have joy in your life, because if you have happiness in your life, then you will also be healthy.
Thank you so much for sharing all those very valuable inputs, sir, here. And I'm sure that people who are watching you will benefit out of that. So that was Dr. Guleria, the director of AIIMS, talking to us about a range of issues that concern health sector and the health infrastructure in our country. Thank you for watching, ladies and gentlemen, and namaskar.